The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision. Today's guest and their company are not affiliated with or endorsed by LPL Financial.
Okay. Well, thanks for doing this. So for people who don't know much about you, do you mind giving me a little bit of background of who you are and how you got started doing what you do?
Sure. I'm Gerard Carrino. I am the Dean of the Julia Jones Matthews School of Population and Public Health at Texas Tech University Health Sciences Center.
Very quick.
Which is a mouthful. The Julia Jones Matthews School at Texas Tech is up on Pine Street. We are headquartered here in Abilene. Most people know of Texas Tech as being a Lubbock entity, right, and that is where the flagship campus for the Texas Tech University and the Texas Tech Health Sciences Center. Most of those schools are in Lubbock, but our School of Population and Public Health is right here in Abilene.
Okay. And so how did you get into public health?
Well, public health is something I bumbled into. When I was very, very young, I was very planful and very purposeful, and I always knew where I was going next and what I was going to do next. But the most interesting things that have happened in my life are things that kind of happened by accident. And I got into public health by accident. Okay. When I was young, I think I was 16 years old or so, I was on the fast track to getting a medical degree in one of those accelerated programs where you could get a bachelor's degree and a medical degree all in 6 years instead of 8 years at a nearby university. And somewhere along the way, what I realized is that I hated blood and guts and biology and certainly organic chemistry. In fact, I hated organic chemistry twice. But somewhere along the line, I realized that it really wasn't for me. And I was searching around, bumbling around. I found a program that seemed much more, an educational program that seemed much more in keeping with my personality, which is solving puzzles and figuring things out, preventing instead of fixing, and trying to affect change at a grand level rather than on a small level. And that brought me to public health. When I first got to an educational program at Columbia University in New York, I was getting a master's degree in public health, and quite honestly, I didn't quite know what it was when I first got there. But after the first 2 or 3 weeks of the program, I realized that it was for me, and it's been a wonderful career choice for me. It has been very concomitant with my personality and whatever skills that I can bring to the table. But honestly, it was purely by accident.
Okay. So what does public health entail? What does it encompass?
Great question. Public health has a lot of different people have different perspectives about what public health is. Some believe public health is health care for the poor or for the disenfranchised. Some people believe that public health those are the folks who wag their fingers and tell you to get a vaccine. Some people believe that public health is low-cost health care. And to some extent, it is some of those things. But really, public health is very different. Unlike clinical health, the kind of health practiced by doctors and nurses and pharmacists and sports medicine, physical therapists, occupational therapists, where their client is an individual patient, our client is an entire community. We don't practice on individuals, we practice on communities. Okay. And the tools that we use for that, we use a lot of math and science. One of our tools is called epidemiology, which is the study of disease over populations, over large populations. We use the tools of policy, behavioral change, psychology, sociology, to affect change, to change people's behaviors so that they can help themselves. And we study disease as it spreads throughout society, not as it spreads throughout the body.
Gotcha. Okay. So I think I had heard you say basically that public health, you should never really know it's happening.
That's right.
It's entirely the environment. It becomes a downstream effect is how the people are doing based upon policies and things that have been enacted to make sure that people are being taken care of. And it's almost like, I don't know, putting on your shoes in the morning.
It should be.
Yeah.
Public health is most visible when it fails.
Okay.
But what you don't know is that right now, every day you wake up, public health has affected your life again and again and again. The fact that we're breathing clean air, that you're drinking clean water, the fact that you don't have cholera right now, you don't have malaria right now. I don't have COVID right now, I just tested. Those are the things that public health does invisibly in the background to make sure that you stay healthy, to prevent illness. And as history goes, what we have learned is that probably more than 80% of health and wellness for human populations is attributable to public health, not to clinical health. Generally in clinical health, we fix people, and in public health, we make sure they don't get sick in the first place.
Gotcha. So most people, they live in an area their entire lives, or they travel, but essentially most of their life is dictated by the public health initiatives that their environment has put into case.
Whether they know it or not, that is correct.
And so you were a transplant to Abilene. So how long have you been in Abilene now?
I've been in Abilene a little less than 3 years now.
Okay, so just kind of compared to other markets that you've lived in, other areas that you've lived in, what are some good things that you see that Abilene is doing well for its citizens and the people who are living here versus maybe other things that you've seen?
How long do you have? Because I could talk about this all day.
I got a while.
That sounds great. I have lived in many communities. I've lived in communities in Ohio and in around New York City, College Station, Texas, Abilene, Texas, Bayonne, New Jersey, Ardsley, New York, Westchester County, New York. I've lived in a lot of different communities, and honestly, I have never found a community that is better functioning than Abilene in my whole life.
Really?
Abilene is particularly good at working well together. A lot of people do a lot of things for a lot of people without seeking credit and without giving a lot of friction to the system. We have a great Chamber of Commerce. We have a great Development Corporation of Abilene. We have wonderful downtown businesses. Folks are truly trying to help each other out. As health and healthcare go, we have some dominant healthcare players within the city of Abilene, particularly in the hospitals. We have a public health department here in Abilene and in Taylor County. And the willingness of people to work together, the willingness of people to come together and to understand very complex problems and contribute what they can and what their expertise is, I have never found anywhere better equipped than Abilene to do that. And I don't say that lightly. I have been in some very high-functioning communities. Abilene is high-functioning and low drama.
Okay. So if we're doing a lot of things well, what would you think that we can do a little bit better?
Always with public health, you look towards infrastructure to make sure that infrastructure is in place so that you can affect change. I'll just give you an example of one thing. If we have folks who need medical care, but they don't have insurance, they may as well not have medical care. If they don't have transportation, they may as well not live near a hospital. If they don't have clean running water, if they don't have electricity, if they don't have food, then a lot of those other things don't matter. When someone is choosing between putting food on the table and getting dental care, they're probably going to choose putting food on the table. And all of those things contribute to health and wellness, and all of those things are essential for health and wellness. And it's not that people make bad choices. Very often they make very rational choices. If I were faced with a choice between getting a tooth pulled and putting food on the table, the rational choice would be putting food on the table. I'm not going to talk about insurance and the accessibility of healthcare. I'm going to talk about something a little bit different. One of the things that would be great for Abilene to do a little better is to provide childcare for folks who need either to get jobs to put food on the table, to get jobs to have insurance, to insure their kids and their families. We are doing pretty well on transportation. You know, things in Abilene,
Right.
nothing's more than 15 minutes away in Abilene, which is nice. But one of the deficiencies, I think, that some of the Development Corporation and the Abilene Chamber of Commerce are looking at are more childcare options.
Yeah.
Because if you have a choice between staying home with a child or staying home with a sick child and going to work, putting food on the table, one thing is always going to trump the other.
That has been a pretty loud issue in Abilene for sure. I mean, it's very much of you. Once you find out that you're pregnant in Abilene, you don't necessarily have to tell the daycare system before you tell your family, but it's a good idea if you would like to make sure that you have a spot for your child. I would imagine that would also help with other things that the DSCOA is trying to do and other kind of corporations and groups that they're trying to bring in, is showing, hey, you're going to have an excellent life for your family here whenever you do move your headquarters here, or you move your plant or whatever it may be here.
And so often that one thing is the rate limiting step. You may have all the other pieces in place. You may have the best healthcare up at Hendrick. You may have the specialists you need here in town. You may have the transportation to get there, and they have free parking, which is all good. But if you don't have childcare, it's not going to matter. And people don't think of that as a healthcare issue, but in fact it is.
Gotcha. Okay. To get more towards your school at Texas Tech here in Abilene, what is the mission of your school?
The mission of the school is to provide, the mission of our school is to promote public health in West Texas and beyond. The way we do that is we have a couple of avenues for doing that. We have education, research, and practice, public health practice. And the way we implement that is through our faculty and staff, our employees, and through those we educate. So we reach out with wide arms to the folks of West Texas to come to the Julia Jones Matthews School of Population and Public Health to learn about public health and then go propagate it and then improve the health of the public. And our faculty in particular go out into the communities to conduct public health practice and research to understand why West Texas suffers disproportionately from certain things. One of the things about West Texas that is interesting and is a huge attribute is that we have all the same needs that everybody has, but fewer people to do it. I do work in the Permian Basin of West Texas, where the cities are very, very small. The populations are not at all dense. They're not just, we've heard about urban communities and rural communities. If you are super rural, it's not even called rural anymore. It's called pioneer communities. That's very, very rural. And pioneer communities are those with populations per geographic area that's even smaller than rural. I'm working in an area that has oil fields, but it doesn't have a movie theater, it doesn't have a bowling alley. It has one Burger King and no McDonald's or Wendy's, and there's not enough resource there. I'm sorry, there's plenty of resource there. They have more oil than anybody. They have a lot of money and a lot of oil, but they don't have the infrastructure to make lives that can be healthy and that can promote health.
Wow.
And researching that particular phenomenon, where the folks have made very rational choices in the moment and for themselves, and yet have not yet developed the infrastructure, the transportation systems to go long distances to healthcare, the activities for young people, the recreational activities for working folks, and the health promoting activities for working folks, like having walkable communities so people can get exercise outside of the oil fields. The fact that they don't have that deserves our attention. And in public health, we study those communities, those societies, those infrastructures, those economies, and try to find interventions that work for the community and from the community.
Wow, that's really cool. What all can a student who goes to your school, what kind of programs can they be in? What does our campus prepare them for here in West Texas?
Right now, we are a relatively new school. We're just a little over 3 years old. We'll be 4 years old in the middle of next year. I've been here almost as long as we have been a school. We have a generalist Master of Public Health degree. That is a master's degree, which means you must come in with a bachelor's degree and probably some science or some math.
Sure.
And it prepares folks to work within public health institutions, nonprofit organizations, centers for disease control, and other public health areas. We're launching, this is very exciting for me, we are launching a bachelor's degree that we hope to have up and running by September of 2027. That's about a year and a half away. We are going for board approval in February, and we also need to go to the Texas Higher Education Coordinating Board for approval. But once this program is approved, we'll be recruiting from community colleges, folks who have something approximately an associate's degree, to finish out a bachelor's degree in public health and commerce here in Abilene, face-to-face up on our Pine Street campus.
Wow.
We're really excited about this because it's a new way of doing public health. We've scoured the country for public health programs, and we believe we are unique. There may be one other program in the whole country that's anything close to this, but we believe we're going to be a unique program that is at the intersection of public health and commerce. Let me explain a little bit why. We all lived through COVID, and with our retrospectacles on, we can figure out all the things that we did right and the things that we did wrong. One of the things that we in public health have understood is that it was not for a lack of epidemiology, it was not for a lack of knowing how to communicate, it was not for a lack of virology or microscopy that we were stuck in our houses for a very long time. We practically had a photograph of the virus. We all know what it looks like, that spiky virus that we've all seen so many times. We practically had a photograph of that in the first couple of weeks of the pandemic. What we didn't have was an understanding of how the public health infrastructure works with the for-profit economy, the business infrastructure, to make public health happen. Okay. For instance, it was not that we didn't know what COVID was or how it affected the body. We were a little ambiguous about exactly how it entered the body, but within several months we knew how it was spread. What we were lacking was an understanding of how to mobilize business to respond appropriately. For instance, supply chain. You remember all the supply chain disruptions during COVID and afterwards. For instance, logistics. For instance, manufacturing. There's a story that when we were trying to put together masks for healthcare workers, people who had to wear masks all day long, that the inside of the mask, the white filter part that keeps you safe, and the outside of the mask, you know, the blue ribbed part that makes it fit, had to be put together, affixed to each other. You put the little straps on, and then you can pull it over your face and put it over your ears. Well, somebody actually has to put the part that filters and the part that fits together, iron them together, put the straps on, and send them out. We didn't have all of those pieces in place during the COVID pandemic, so there were huge mask shortages at the beginning of the pandemic. There were masks sitting in warehouses that couldn't be distributed. What we were lacking during the COVID pandemic was an understanding of the business of public health, of the intersection of public health and commerce.
Interesting.
And our bachelor's program will be the first in the nation to teach that.
Really? Wow. What other programs can they do at your campus?
The Abilene campus of Texas Tech University Health Sciences Center includes programs in pharmacy, in nursing, in biomedical sciences, and in public health. We have a couple of nursing programs that prepare students for a very, very high demand job of nursing. I don't know what the statistics are this year, but last year, this area in the big country was 700 nurses short.
Right.
And we are working to fill that gap. Pharmacy, similarly, there are shortages all over the nation. And in our biomedical sciences labs here up on Pine Street at the Abilene campus for Texas Tech Health Sciences Center, frankly, they're curing cancer.
Okay.
We're working on multiple initiatives, studying many things. The one that sticks out to me is the wonderful work that's being done in cancer.
Okay. What types of cancers are they working with?
I believe, this is not my area of expertise, I believe colorectal cancer, breast cancer, and a few others.
Okay. And you guys partner with the Presbyterian Medical Care Mission on colorectal cancers and screenings. And so they have some incredible initiative where basically the PMCM is I think the largest collector of data and screenings in Texas or something like that, or like some ridiculous nationwide kind of number. So just thought it was interesting. It's all happening here in Abilene, but
It's all happening here in Abilene.
yeah.
And a lot of West Texas has a disproportionate share of many cancers.
Okay. Such
So,
as
one of the problems we have is a low screening for breast cancer. In conjunction with the Laura Bush Institute, Texas Tech Health Sciences Center is partnering with a company called BEXA that has it's a non-invasive, much more comfortable than a mammogram screening tool that allows women to screen for breast cancer without having to receive a mammogram.
oh wow, that's amazing. It seems like there's so much going on just along with your campus. As someone who studies what initiatives like this, what opportunities like this for education, growing talent and expertise here in a community, I kind of wonder what that would maybe look like, how that affects this area in the next 10 or 20 years, just having so many places where students can get educated, ways that they can kind of learn about pretty much anything here in Abilene, basically. And so what are your kind of thoughts for how we're developing people and what we might be seeing in the future?
Abilene is very special in this respect. Per capita, we have more universities than almost all the rest of the United States. In fact, we have about 4 times as many universities and colleges per capita in Abilene as compared to U.S. averages. We're way on one side of the distribution of per capita universities. We have programs in almost everything. You can go to Abilene Christian, to Hardin-Simmons, to Cisco, to McMurray, to Texas Tech University Health Sciences Center, or you can find a trade at TSTC, the Texas State Technical College. We are extremely lucky with higher education in this area. And I know we serve the entire big country, but those in Abilene don't even have to drive very far. It is a testament to the folks in Abilene and to the planners and the philanthropists that we now have the health sciences firmly established in this community and in this 21 county area. I think one of the things that will happen to Abilene over the next 10 to 20 years is going to be 2 things. Number one is steady growth, because we have been steadily growing, not fast, but steadily. And I think we're also going to have a lot of very sporadic growth that is associated with the data centers coming in the north and the Dyess Air Force Base B-21 bomber coming into the west. I believe that those 2 things together will have impacts on housing prices, on growth, on the types of folks who move into Abilene and stay. One of the things that I have witnessed over the last 3 years is the sheer number of people who come to Abilene and just want to stay here.
Yes.
Or the number of people you talk to who say, well, I grew up in Abilene, then I went away for a while, and I just had to come back. Um, the cashier, the person who cuts my hair, the person who mows the lawn, say, I went away for a small while and I just had to come back. I wanted to raise a family here. I went to ACU and I wanted to get back to the football games and to the community that I found there. So I think we have a lot of staying power, and I think we have a lot of attractive power, meaning that folks are going to be moving here. So one of the things we have to do as a community is to plan for thriving, not just plan for the roads and the streets and the water. Those are all very important too.
Right.
But we also need to plan for thriving. And part of thriving is something that public health contributes to a lot. Public health is not just the health of people in large communities, it's actually also part of the health of the community itself.
Okay.
Economically healthy communities tend to be healthier physically. Communities that are physically healthy tend to be economically healthy for a whole host of reasons that I could go on and on about.
Is part of that a comorbidity, or is that more causational, do you think, on either side?
I know it's associated. I can't, my research training tells me that I can't say causation and causality and correlation are the same thing, but I know that they are closely associated.
Okay.
I could give you a lot of ways that I could say that good health causes good economies and good economies cause good health, but we know that they are correlated.
Either way, the effect is the same.
So
we should be chasing one to get after either. Yeah.
One and the same, I think. As we grow, whether it's slow and steady or sporadically in bouts, as we are likely to do over the next 10 years, preparing to thrive includes understanding those underlying infrastructural issues that help people have good health.
Okay. How so? Or what does that entail?
More daycare.
Okay.
Make sure the transportation to the clinics and the hospital are reaching the newer neighborhoods. Understanding what happens as we sprawl. There's a lot of growth in South Abilene, and those folks are further away from the healthcare. Hendrick now has Hendrick Hospital South servicing those areas that are growing a little bit more. North Abilene has some wonderful developments in commerce and making sure that those neighborhoods are logistically, physically, and economically connected to places to thrive. But one of my favorite commercial districts in Abilene is Allen Ridge, because it has that beautiful lake and park behind it, and you can walk around the lake 2 or 3 times to get your steps in, go have a beer at Cork and Pig, and maybe get some pho from Phoenix Pho, and making sure that those kinds of areas that help people to thrive is something that we can demand more of as consumers in Abilene.
So that would be exactly what you mean by an intersection between the private economics of an area and the actual general health of its people. Obviously, that was kind of an institution that was put in through ACU and private money, however, has lots of effects on the actual population in that area.
Absolutely.
Okay. Just trying to make sure I'm catching it and making sure I don't sound like I completely am lost a lot of time. What are some other, what's something else that your school is actively trying to address or pursue work with?
At the Julia Jones Matthews School of Population and Public Health, one of the things we are very focused on is the coming together of all the higher education institutions in the community. We have 6 of us, 6 different institutions of higher education who have come together to pull together what we call the Intercollegiate Council, the Abilene Intercollegiate Council, and we would like to work together to improve the community of Abilene and the economy of Abilene. We are, as 6 colleges and universities an economic force. And when we work together and strategically and synergistically, we can help Abilene thrive.
Wow, it's amazing. Any other new opportunities or collaborations coming up for the school?
No.
No, it's done. We did it all. Okay, so looking at the next, say, 3 to 5 years for your school, what are you hoping kind of grows in ways of programs or things that y'all are doing?
In the next 3 to 5 years of the Julia Jones Matthews School of Population and Public Health, the most exciting is the launch of a bachelor's degree in public health and commerce, which we expect to happen in the fall of 2027, pending approval by our Board of Regents and the Higher Education Coordinating Board of the state of Texas. I'm very excited about this. We are going to be bringing students on campus 2 semesters each year. We will be admitting new students, and they will be learning something that is unique within the country and unique within public health. What I'm really excited about is what we're calling the Abilene Undergraduate Ecosystem, which is a measure of figuring out how to get students who are either from Abilene or come to Abilene for their education to really be plugged into the community, to become part of the community, and to want to stay in the community.
Okay.
It's our goal that if we create the right ecosystem for them, that students will want to be here, to stay here, and then to practice here.
So what are some of those areas that we need to develop for that ecosystem to make sure that we are catching and keeping a lot more of the talent and young, bright minds that are moving to this area for school?
Some of the things we need to make sure that our young people have access to are age-appropriate entertainment, age-appropriate venues. For instance, for undergraduates who are under 21, establishments that are primarily revolving around alcohol are not appropriate for those folks. Some students who are over 21 may be able to partake of many of the downtown amenities that we have here, but we probably need a lot of things for students to do, to intermingle, to mix, to meet folks. More than that, I was part of a group, you and I were together in this group, called Leadership Abilene, which is one of the best things I have ever done in Abilene was to join Leadership Abilene. And we had the privilege of going from business to business, from nonprofit to nonprofit, from agency to agency, and learn about what they do, why they're special, and just how much they contribute to those invisible things around us. We went to a place that manufactures boats. We went to a place that bottles colas. We saw 11 nonprofits one day and the wonderful work they're doing. And getting plugged into the pieces of Abilene, the movers and the shakers of Abilene, the economic drivers of Abilene, really brings you into the fold in a way that makes you want to stay, to contribute, to practice, and to make things better. I would love for our students to have a similar kind of experience where they actually get to understand how manufacturing businesses, how small businesses, how big businesses, how a bottling company, how nonprofits work, what they do and why they do it, and how they can get involved. When folks have purpose and can see the bigger picture, they're so much more engaged. And I would like for our young people, particularly undergrads, to get engaged with the community.
Do you think that's an area that's been kind of lacking? As far as, I mean, obviously we have these students who come here, but do you think it's just been something that's been missing from their education, something that's going to bring them off of the campus outside of nightlife or outside of entertainment?
I'm a little beyond 20-something.
Okay.
So I can't speak from experience.
I couldn't tell.
I can't speak from experience if there are things to do if you're 20 years old or 19 years old. I suspect we could stand to have a little bit more of that. Only so many bowling alleys and movie theaters, but it would be nice to have a place for those students, those young people to congregate. But what I can guarantee you is that we would be better off if we were purposeful and collaborative about coming up with those types of ecosystems. In the Abilene Intercollegiate Council, we are beginning to have conversations among 6 colleges and universities about how we can create those kinds of opportunities for young people, no matter which school they go to, collaboratively, synergistically, intermingled. I would love for Hardin-Simmons students and Texas Tech students and Abilene Christian students and McMurray students and Cisco students all to get together somewhere, to learn together, to explore together, and to fall in love with Abilene altogether.
That's wonderful. As you've been developing the school, as you're working alongside of them, what does success look like for your school right now?
The true measure of success is a community that is thriving in health. Not just health care, but thriving in health. There are a lot of intermediate steps along the way, and thriving in health is such a long-term goal that that's not where I put my focus on a day-to-day basis. It's the guide star. Success for my school will be launching this new bachelor's program, bringing students in who become extraordinarily excited about public health and commerce and community, situationally aware graduates who become transformative powers within their companies and within their communities, people who are doers and engagers and want to be a part of something bigger than themselves. To me, that would be success.
What would success look like for you in your role?
Oh, really good question. Growing the school. I'm the inaugural dean for the Julia Jones Matthews School of Population and Public Health. Been at it for almost 3 years, which is about as old as the school is. We would like to grow the school to have a solid, permanent, visible presence within this community.
Excellent. Since you've been working in this field for some time, what were some of the moments that were pretty formative, or experiences that you had that were formative for how you look at things, how you just move forward?
The obvious answer to this question would revolve around COVID, when we learned so much about what was right and what was wrong with public health and the public health infrastructure and the public health system. But I've talked enough about COVID, so I want to talk about something a little bit different. Years ago, I worked at an organization called March of Dimes Foundation. Our mission was to improve the health of babies by reducing the incidence of premature birth, birth defects, and infant mortality. So we were a babies organization. As you know, a babies organization is inextricably tied to moms as well. So we were really a moms and babies organization. The health of the mom was so influential on the health and viability of the baby. So most of the people we worked with directly were moms, not babies themselves, but were moms, were pregnant moms, and those who were about to deliver. And one of the things that we determined was that when you have a rallying cry, when you have a thing to rally around, that people come out of the woodwork and want to help, want to contribute, and want to be a part of something bigger than themselves. We did a project in Kentucky wherein we took every evidence-based intervention to reduce preterm birth.
Okay.
At the time, there were about 9 of them. There were about 9 things that you could do that programmatically had an evidence base, scientifically proven that they could reduce preterm birth. And we said, what would happen if you put all 9 of those things together at the community level and made sure that every pregnant woman had access to those things? And a couple of things happened. Number one is we found community partners whom we otherwise wouldn't have found. Every community we had a hospital, a health department, and some nonprofit organizations, but in every one of those communities, we found people we didn't even know we needed. That's the infrastructure piece. Don't even know you need transportation. Don't even know you need daycare. Those are the kinds of things where when you have a problem to solve, people rally around that and solve the problem with you with whatever tools they have. If you're a daycare provider, you figure out how daycare can help the prematurity program. If you are a Coca-Cola bottler, you can figure out how Coca-Cola bottling can help the prematurity problem.
Yeah.
The second thing we found is that when you put all the interventions together, sometimes the whole is greater than the sum of its parts. And the third thing we found is that when you do this at a community level, with community buy-in, with the movers and the shakers of people who have the same interest and didn't even know they had the same interests, you get great results. Prematurity went down in all of our test communities by a substantial amount.
It's amazing. It's a really cool story. Any advice you have for students, professionals who are wanting to get into public health or just anything to do with your school?
Yes, absolutely. The first advice I have for students is be curious and don't be certain. I told you earlier that when I was young, I was very planful and very purposeful, and I always knew what I was going to do next. But the most amazing things that have ever happened in my life were all by accident. Let accidents happen.
Yeah.
Don't get into accidents. That's
Sure.
a terrible public health message. But let accidents happen. Let serendipity happen. Let others change you. Change your mind. Change your convictions. Change your political party if you want to. Change what you think was going to happen and let it happen. Some of those students will come into public health and commerce. The advice I have for students or prospective students who want to get involved is be driven both by your convictions and your heart and by your mind and some logistical realities. Here's what I like about public health and commerce. It has all of the altruism of helping others and making your community better that any degree does. And commerce has all of the nuts and bolts business skills that any employer would like. So any student who wants to get involved will have hard skills and heart skills.
That's awesome. Anything that you wish that more people in our community or any community better understood or appreciated about the work that you guys do?
Yes, absolutely. Public health is best when it is invisible. The sheer amount of work we do in the background, the sheer amount of protection we provide in the background with nobody knowing it is mammoth. And just because you don't see it doesn't mean it's not there. I liken public health to the people at your job who might maintain the computers and the systems, the IT folks. You don't notice it until something goes wrong, but they're always there. They're always protecting you. They're very highly skilled. They do a lot of work, but you never notice them until something goes wrong. That's kind of the way public health is.
Gotcha. Why do you think it is that we're living kind of in a time where there's a lot of hyper focus on small details regarding different areas of public health, but very few people like yourself try to put it in the larger perspective? And why do you think that we're running into a lot of that today?
I think we're running into a lot of that today because the platforms incite it. That is, the social media platforms, the news cycles, politicians, influencers like to grab onto small details and expand them for their own purposes. Sometimes they expand them for their own purposes to forward an agenda, a business agenda, a political agenda, a personal agenda. And sometimes we are just, we as consumers are held in a bubble of, or an echo chamber of our own thoughts through social media and through the friends we pick and through the influencers we follow, and it just escalates a little out of control. Bottom line is, if the only thing you ever think about public health is those are those folks who made us stay in our houses for too long, you can think that if you want to, and it might even be true, I don't know. But the breadth and power and influence of public health for the last 125 years has saved more lives than anything that has happened clinically, and anything that has happened, almost anything that has happened in all of humankind. Our life expectancy has risen dramatically because of major public health initiatives like clean water and clean air, hygiene and sanitation. Those things have had more of an impact on your life than anyone will ever know or appreciate now.
Wow. I would imagine, to oversimplify things like kind of what you're saying about essentially the algorithm that people are into. It's very easy for, hey, this is coming up in this area that you're interested in. We're going to continue giving you feedback and search results for that one issue rather than a larger picture necessarily. Where do you think that people can find a source that's easy to digest, that they can learn more about these things? It's like you're saying, people are not necessarily unrational or unintelligent. They are very intelligent. But it does seem to be, there is kind of a wall around academia that unless you're going to become enrolled on the campus, you don't really have a place where you can go and access and learn more about things that you guys do, initiative, to be able to get that broader sense. And so people are kind of, it's not the best tool that we have, but it's the tool that we have. So where do you think would be where people should be getting a little bit more of information so they're getting more of a whole picture?
That's a great question. The tried and true sources, of course, are probably pretty good. But I think really what your question is much more is a call to action for those people who are in the know to adopt the platforms that people are actually using. In academia, we have a tendency to count as currency something called peer-reviewed publications. So you go to the Journal of the American Medical Association and you do a very high quality study, and it goes through a very rigorous review, and your peers review it, and you get rejected 2 and 3 times, and then you rewrite it and you rewrite it and you improve it and you make it more rigorous and more statistically sound, and you submit it again, and finally you get published in a big medical journal or a big public health journal. And that's the currency of academia, because you can count those things, and if you do enough of those, you must be a very good academician.
You get to put it on your CV. It's read entirely by other professionals.
I would invite those folks who have arrived with a lot of great peer-reviewed publications and wonderful journals, I would invite them to start a YouTube channel, to start a podcast, to sit in your office and talk about what they know.
Awesome. Great. Any kind of last minute things that you're excited about right now on a personal level, something that you're looking forward to outside of the school?
I would say outside of the school, what I'm most looking forward to is the next 5 years in Abilene. I think it's going to be a very exciting ride. With the data centers coming in, with the B-21 bomber coming in, I believe Abilene is really set on a wonderful trajectory, and I'm looking forward to growth. If we could get a Costco, that would help me a little bit. Maybe a Trader Joe's here and there.
Sure.
Glad Chewy's is coming. Haven't been there yet.
Right. Where can people connect with you or connect with the school and find out more?
To find out more, you can contact me directly. I'm Jerry Carrino. My real name is Gerard Carrino. I'm at Texas Tech University Health Sciences Center up on Pine Street and 16th. And I'll give you my email information that you can publish.
Okay, wonderful. Any last minute things that you want to talk about or anything else?
I don't think so.
Okay. Well, thank you so much.